kupigwa katika kudhibiti ugonjwa wa malaria nchini, huku ulimwengu ukiadhimisha siku ya ugonjwa huo. Wizara ya Afya inasema ingawa hatua kadhaa zimechukuliwa kufikia sasa, mengi zaidi yanahitajika kuchukuliwa. Kwa sasa, mtazamaji, tutavuka moja kwa moja hadi katika jumba la Afya House tusikilize.
Can know what is awaiting them between now and July 31st. Yes.
These nets are used for their right intended purposes. We know very well that nets have been used for other purposes in the past, either as fishing nets or for chicken coops. So we want to advise the recipients, please, these nets save lives. Use them for the purposes they are intended for.
So we are going to request the chief guest to hand over to one of the malaria program officers that carton as a symbolic demonstration of the ministry handing over these nets to the counties through our medical agency, KEMSA, who will be supporting their distribution. So thank you very much, and therefore the counties should be looking forward to receive the nets. Finally, one more.
The last launch happening during this year's World Malaria Day is a launch of our case diagnosis and case management guidelines. These are guidelines that are going to guide us in being able to correctly diagnose malaria and be able to appropriately treat it within the constitutionally assured highest attainable quality of health standards. So I think we are proud as a program to have been able to develop these programs together with all the stakeholders and county governments, and they shall be guiding our diagnosis and treatment for malaria for the next several years. So thank you very much, Dr. Rashid, for being able to launch these guidelines. And thank you for handing them over to the program to implement. Thank you.
We want to do it after. Yeah. On malaria, all of it. You know you had said, or you can sit as we answer them? Yes. Okay. Yes, that's what we go ahead. Yeah, listen, yeah. Okay, today is Malaria Day. Questions malaria. We want questions malaria today. We want to learn this disease, eh? So if there's anybody with questions on malaria, we also have other experts here from KEMRI. We have Professor Gutu is here with us. If you have questions on the vaccine, he's going to answer you. On the malaria vaccine, not the COVID vaccine.
Helen Aura from NTV. My first question is regarding Bonasi, as you had said that the plan for ending malaria, you're looking to engage youth in the high endemic areas. So how exactly are you looking to engage this youth to be able to combat malaria, especially in these high endemic areas? My second question is regarding the malaria vaccine. You said the vaccine is going to be in 4 doses. So the first dose was administered in September 2019, as you had stated earlier. So far, the assessment of this vaccine, is it working, or where are we standing with the vaccine so far for malaria? And we spoke about, this is to the chair of the End Malaria Vaccine Task Force. You spoke about the 24 billion deficit. I remember earlier on during the year, we still had the same issue of the 24 billion deficit. So are we trying to say there's nothing that happened since the launch of the council early this year up to now? Nothing has happened, or where are we standing as a nation so far? Thank you.
Can we take another set of questions and I will guide how they are answered? Oh.
My name is John from KBC. The efficacy of this vaccine. Oxford is reporting 77% efficacy in a vaccine that they're testing. I don't know whether you can tell us about the efficacy of this particular vaccine and who actually are the experts dealing with it. Thank you.
Okay, so maybe to guide how we respond to this, let me call Professor Gutu to respond to the issues of the vaccines. Then we'll call the chair to respond.
Na mtazamaji, ni taarifa ambayo inatolewa kwa sasa katika jumba la afya kutokana na maambukizi ya ugonjwa wa malaria. Ni mojawapo ya taarifa ambazo tunazidi kufuatilia katika chumba chetu cha habari.